Well, in this morning's Health Alert, we're talking about leukemia. It is Blood Cancer Awareness Month, and we're joined this morning by health coach Noor Dano. And Noor, thank you so much for joining us. We mentioned leukemia. People have heard about it, but most people, or many people at least, don't know exactly what leukemia is. What is leukemia?
Leukemia is the cancer of the blood, including lymphatic system and bone marrow. It is referred to as the liquid tumor because it circulates throughout the body. It's not concentrated in a solid area or solid tumor like breast cancer and colon cancer. There are three different types of blood cancer. We have leukemia, lymphoma, and myeloma. And there are several broad categories of blood cells, including red blood cells that carries oxygen throughout the body, the white cells that fight infection, and the platelets that stops the body from bleeding when we get injured. Leukemia is the cancer of the white blood cells. It's a disease in which your bone marrow produces abnormal white cells that aren't able to fight infection.
And so what are some of the symptoms? I mean, your white blood cells fight infection as part of your immune system. So if they're damaged, what are some of the things people should look out for?
Weakness, symptoms of leukemia, weakness, fatigue, sweating at night. When they're brushing their teeth, they might get bleeding gum, nosebleed, a large spleen, a large liver. So all these symptoms are not always related to leukemia, but if we get any of these symptoms, we should check with our oncologist or hematologist to do the white blood test to figure out what's going on.
Now, we hear of leukemia. Many of the times we think of cancer as being something that strikes us almost like a thunderbolt. We don't always think of some of the things that we do to minimize or maximize our exposure. Are there things that we can do to help protect ourselves or to either mitigate against getting leukemia?
Sure. Cigarette smoke contain benzene. Benzene is linked to leukemia. A lot of chemicals, benzene is found in herbicides and solvents. It could be also exposure to radiation. Some medicine also can cause leukemia. So best way to prevent it is to avoid cigarette smoke, eat a main diet of plant-based food, limit sugary and alcoholic drinks, and be physically active for 30 minutes.
And those are great choices no matter what your lifestyle
whether we
is.
have cancer or we don't.
Right. And if you talk to a doctor, they'll tell you a lot of those things. Now, how is leukemia treated? I mean, and are there some ways to make the treatment easier? Because when we think about treatment for cancer, we think of a pretty rigorous regimen. Treatment
could be radiation, chemotherapy, even food. If we eat the right food, we can help with the treatment. A lot of cruciferous vegetables like bok choy, kohlrabi, arugula, Swiss chard. These food is rich in an active component called sulforaphane that kills leukemia cell. Acai berries, they found it's from Brazil. It kills up to 86% of leukemia cells. Turmeric kills childhood leukemia.
Yeah.
Yep. So these fruits and vegetables, these food that help heal fast.
So we're back to diet. Noor Dano, thank you so much for joining us this morning. Really appreciate it.
Thank you.
And we'll have more information on our website, WXYZ.com.